Greetings. Let me share with you what all we need to do in terms of planning to deal with the COVID-19 pandemic as endoscopists. I would like to thank grant support from John Stroline Endowed Professorship, Mr. Charles Butt and H.E.B. Grant, and especially Miss Angela Deal, the medical illustrator who helped me with this presentation. So these are the different topics I wanted to cover, and my goal today is looking from the beginning to the end, and this is based on reading these resources, and I want to thank all these authors for educating us, and let us start. So there are a few things you need to do. First thing is you need to look at your workflow, the current workflow of your endoscopy unit, and need to make some changes. Figuring out where COVID positive patients will go in terms of the waiting area, preparation and recovery area, which restrooms are they going to use, and which endoscopy rooms will be designated as COVID positive cases. And in addition, it's also a good idea to create a donning and doffing of PPE rooms so that both donning and doffing could be done properly. And this is a very critical step to prevent contamination and infection. And also important to change one of the rooms if there's not much space to help the staff change the changing room. And we need to put in some rules about how people use the break room. So these physical plans should be done. And another important aspect in terms of preparation is education on infection prevention in endoscopy with special reference to COVID-19. As you know, the infection can enter the triangular area of the face from the eyes to the nose to the mouth, and that's the area you should protect. And one should be educated about proper hand hygiene using soap and water, and also using hand sanitizer, and follow the steps religiously. In addition, one should wear the PPE required for this operation, starting with hairnet, face shield, N95 mask, impermeable gown, double gloves, and shoe covers. It's important to get into the habit of doing hand hygiene before touching face, eyes, and nose, before and after contact with the patient, before donning PPE, and before every step of doffing of PPE. One should avoid contamination during doffing because recently it's been shown that the error rate is pretty high as 90%. And mistakes can be very costly. So, it's important to practice proper hand hygiene, proper donning and doffing of PPE. So, in addition to changing the physical structure or workflow, getting ready with infection prevention practices, the endoscopy unit should have a game plan about cutting down elective cases and figuring out what urgent cases will be done. And in addition, one should also look at how do we risk stratify patients according to their COVID status. Now that the COVID test is available wherever possible, it is a good idea to test for COVID so that appropriate precautions could be taken. And ideally, a negative pressure endoscopy room is preferable. If it's not available, go for a well ventilated, wide open endoscopy room. And every member in the team should wear N95 mask, goggles, face mask, gown, and gloves, as we discussed. The key is to screen patients before they come to endoscopy, asking them about symptoms of upper respiratory tract infection, lower respiratory tract infection, as well as GI symptoms, starting with loss of taste, smell, diarrhea, etc. Also, to find out about contact, travel 14 days prior, and whenever there is a concern, they should be tested for COVID-19. And as time passes, with wide availability of testing, it makes sense to do the testing so that we avoid getting exposed to asymptomatic carriers. Once they come into the endoscopy center, we should encourage them to maintain social distance of 2 meters, wear a mask, ask them to do hand hygiene at the before they enter the endoscopy reception area. Relatives are not allowed into the endoscopy unit to minimize the spread of infection. One more time, we do the screening and check their temperature, and if they are negative for both, then they go in for their procedure. Some patients may be COVID positive, and it is important to know that. In terms of the pre-op and post-op area, it is a good idea to space them apart to cut down infection transmission. And if you know of a COVID positive patient, schedule them at the end of the day. And it's important to clean the surfaces to prevent fomite related transmission of COVID-19. When you go to consent, make sure you maintain social distance and if possible, convert your consenting process to verbal consent. That way you minimize exposure. So once the patient is prepared and about to be brought into the endoscopy suite, you get ready. Make sure you wear the PPE properly, you check your equipment, and be ready with your PPE on before the patient is brought into the room. Another important step is to clean the surfaces. And it's a good idea for the endoscopist to get into the habit of cleaning their work area, computer screen, keyboard, mouse, telephone, chair, etc. And when you're about to start the procedure, again keep in mind of maintaining the social distance. Every patient that comes into the endoscopy suite, right at the time they enter, they should have a mask, and that mask should be kept on until you are ready to sedate the patient. Depending upon the type of sedation that the anesthesia team decides, one could use propofol sedation, and in that case, you may want to avoid nasal cannula to cut down the risk of airborne transmission or aerosol generation. A face mask is an ideal way to do, and in high-risk cases, it's a good idea to intubate the patients and manage them. You should minimize the number of people in the room, and after the procedure is done, it is important to clean the surfaces, and this is very critical, to clean all surfaces to cut down the risk of infection transmission. The nurse, the technician, the endoscopist all should play an active role in cleaning the surfaces. And once you're about to leave the room, there are a sequence of steps you need to follow in terms of doffing your PPE. you should ask one of your assistants or a nurse to untie the back of the gown. If that's the type of gown you use, you do not want to use your hands to reach out to untie like we normally do. And remove the gown inside the room, close to the door, with the assistance of a second operator, and remove the gown from inside out. Next, remove the first pair of gloves and then perform hand hygiene. Next, remove the second pair of gloves and again perform hand hygiene before exiting the room. It is critical to repeat hand hygiene a number of times after every step. Once you go out, you need to perform hand hygiene again after exiting the room and then putting on a new pair of gloves, clean gloves. Use a germicidal wipe to disinfect the surface where the face shield will be placed. Perform hand hygiene and then remove the face shield by grabbing on the elastic band on the back side without touching the front of the face shield. Avoid touching the front of the face shield because it is contaminated. Use a germicidal wipe to disinfect the face shield before placing on the surface. Then you remove your gloves and then you perform your hand hygiene again. Subsequently, you remove the surgical mask by holding on to the elastic rings going over the ears and without touching the front of the surgical mask. Discard the surgical mask because it is contaminated. Again, perform hand hygiene. Finally, you remove your N95 mask, again without touching the front, by holding on to the elastic rings on the back of the head and removing the lower one first and then the upper one, and then pushing your N95 out of the face. And then perform your hand hygiene. If you are, like many of us in the United States now, with scarcity of N95 masks and face shields, it is a good idea to reuse them, and you should store your N95 mask in a paper bag as shown here. You want to hang it, the front side down into the bag and the clean side up, and so that when you take it back, you have the clean side getting onto your face without touching the front side. Also, you want to put your face shield in another bag. Finally, before getting out of the room, wear a surgical mask and keep the surgical mask on until the end of your shift, unless you need to wear the N95 mask again for the next case. When it comes to going and putting the report, either you could put the report. In some centers, there's an assistant or a physician that does the report to minimize contamination. When you go to put your report, make sure you clean your work area, your keyboard, your mouse, your computer screen, your chair, your phone, again with a disinfectant. And once you clean the area and allow that area to dry for 20 seconds or more, then you can put the report. And after putting the report, again perform hand hygiene. So it is very important to practice hand hygiene after every step whenever you touch any surface, so as to cut the risk of infection transmission. I would like to make an acknowledgement here. I want to thank Roy Sitikno for educating me and also sharing the document that Dr. David Carlock, Roy Sitikno, and his colleagues wrote on doffing PPE with the reuse of N95 mask and face shield. And that document served me to create this instructional video. I hope we can have enough supply so that we don't have to reuse N95s or the face shields. For now, we are in a desperate situation. Hence, when we reuse, we should take proper precaution to do it right. Be safe. Thank you.